welcome back to my YouTube channel. In this video we will talk about maxilla. Its side determination is the most important point to find out which side of the maxilla is it. So we will talk about maxilla, its sides, its feature and many more. Let's start the video. Maxilla is the second largest bone of the face, the first being the mandible. There are two maxilla from the whole of the upper jaw, and each maxilla form a part each in the formation of the face, nose, mouth, orbit and infratemporal pterygopalatine fossa. Side determination: anterior surface and medially into a deeply concave border called the nasal notch. Posterior surface is convex, alveolar border with the sockets for the upper teeth, face downward with its convexity directed outward. Frontal process is the longest process which is directed upward. Medial surface is marked by the large irregular opening and maxillary hiatus antrum of the high for the maxillary air sinus. Features: each maxilla has a body for four process: frontal, zygomatic, alveolar and palatine. Body of the maxilla: the body of the maxilla is pyramidal in the shape, with its base directed medially at the nasal surface and the apex directed laterally at the zygomatic process. It has four surfaces and enclose a large cavity maxillary sinus. Surfaces are anterior are facial, posterior are infratemporal, superior are orbital, medial are nasal. Then we will talk about its remaining features. Four process of the maxilla, which is zygomatic. The zygomatic process is pyramidal lateral projection in which the anterior, posterior and superior surface of the maxilla converge. Frontal process project upward and backward of the articulate above the nasal margin of the frontal bone. And then alveolar process form the half of the alveolar arch and break socket of the root of the upper teeth. In the adults there are 8 sockets. Kidney socket is deepest, molar socket are widest and divided into 3 minor sockets by septa. The incisor second premolar socket are single and the first premolar socket are sometimes divided into 2. Buccinator arise from the posterior part of its outer surface up to the first molar tooth. A rough ridge, the maxillary torus, is sometimes present on the inner surface opposite to the molar sockets. Now we will talk about the palatine process. Palatine process is thick horizontal plate projecting medially from the lowest part of the nasal surface. It forms a large part of the roof of the mouth and the floor of the nasal cavity. Inferior surface is concave and the two palatine process from the anterior 3/4 of the bony palate. It presents numerous vascular foramina and pits for the palatine glands. Articulation of the maxilla. Superiorly, it articulates with the 3 bones, nasal, frontal and lacrimal. Medially, it articulates with the 5 bones, ethmoid, inferior nasal, concha, vomer, palatine, opposite maxilla. Laterally, articulate with 1 bone, the zygomatic. Ossification: maxilla ossify the membrane from 3 centers, 1 for the maxilla proper, the 2 for its incision or premaxilla. The center for the maxilla proper appear above the canine fossa during the 6th week of the intestinal life. Of the 2 premaxillary center, the main center appear above the incisive fossa during the 7th week of intestinal life. The second center appear at the ventral margin of the nasal septum during the 10th week and soon fuse with the palatal process of maxilla. Through the premaxilla begin to fuse with the alveolar process almost immediately after the ossification began. The evidence of the premaxilla as a separate bone may persist until the middle decades. Now we will talk about the age-related changes at the time of the birth. Transverse and anteroposterior diameters are each more than the vertical diameter, and frontal process is well marked. The body consists of a little more than the alveolar process, the tooth socket reaching the floor of the orbit. Maxillary sinus is a mere furrow on the lateral wall of the nose. In the adult, vertical diameter is greatest due to the development of the alveolar process and increase in the size of the sinus. And the last one is in the old, the bone reverts to infantile condition. Its height is reduced as a result of the absorption of the alveolar process. So guys, if you have any query in this topic, so you can ask me in the comment section. If you like the videos, please subscribe my YouTube channel. Thank you so much for liking and watching the video.